Section 2. Risk factors for falls among older adults. Different factors in a patient's life contribute to their risk of falling. Some factors are modifiable, while others require a patient to adapt their lifestyle. 1. Biological factors. Age. The risk of falling increases with age. The elderly have decreased gait and balance. Additional risk factors of falls in the elderly include fear and anxiety of falling, limitation of activity, and decreased reaction time. Vision. Decreased visibility and vision impairment contribute to falls. Physical disability. Affects balance, mobility, and/or a person's ability to use their upper or lower body, and some forms of physical disabilities can reduce a person's reaction time. Chronic diseases. Different diseases can put patients at higher risk of falls. Diseases such as Parkinson's, Alzheimer's, dementia, diabetes, and any disease that can cause cognitive impairment, disorientation, and wandering. Incontinence. Incontinence urges, wet and slippery floors from incontinence accidents, along with waking up quickly and frequently to use the bathroom, puts patients at higher risk of falling. Pain. Uncontrollable muscle pain, pain on exertion, orthostatic hypotension, and syncope can put patients at risk of falling. 2. Pharmacological factors. Medications that affect balance. A variety of medications have side effects that affect a person's balance and coordination, such as those that cause clumsiness, confusion, lightheadedness, and dizziness. Vision-altering medications. Some medications can cause blurred vision or narrowed vision, which may affect the person's ability to judge distance and increase the risk of falls. Medication interaction. Many patients take different kinds of medications at the same period, and medication that, when taken alone, may have no effect on balance and gait, can interact with each other and generate side effects that increases the patient's risk of fall. 3. Psychological factors. Mental disability. Impaired cognitive function can cause a patient to become slow at processing information and increase reaction time. It can also contribute to reduced memory and difficulty avoiding distractions. Depression. Depression can cause lack of concentration, poor self-care, low energy, inactivity, and slower response time to environments, all of which can increase the risk of falling. Anxiety. Anxiety can affect decision-making, fall interruption, and balance confidence. 4. Socioeconomic factors. Neighborhood. The density of housing and the location of a patient's residence can contribute to incidences of falling, walkways, neighborhood cleanliness, etc. Patient's participation in social activities. How well activity centers that the patient frequents are prepared to manage and prevent falls can affect the risk of falling. Influence from patient's social circle. Where the patient works, entertains, and the risk-taking behaviors of people he or she spends time with may put a patient at risk of falling. 5. Home environment factors. Patient's home design. Residences with stairs or long and poorly maintained entryways may present a fall risk for the patient. Home organization. The layout of the home, furniture, number of home occupants, and accessibility to everyday household items that a patient may need can put them at risk of a fall. Poor lighting in the patient's home. Inadequate lighting is one of the main risk factors of falling. Audio clutter. Audio clutter includes all the noises in the home. Radio and television volume and people's conversations can interrupt patients' concentration or cause distraction that can lead to a fall. 6. History of falling. Fear and anxiety of falling. The trauma and anxiety sustained from a past fall can interfere with a patient's confidence and put them at an increased risk of future fall. Injury sustained from previous fall. Injury and weakened muscles can increase the risk of future falls among patients with a history of falling. 2A. Modifiable fall risk factors. Some of the risk factors, such as home environment, are easily modifiable. The following are 4 groups of modifiable risk factors. 1. Biological. Problems with balance. Injuries. poor vision, mobility problems, body weakness, legs or lower body weakness. 2. Pharmaceutical, multipharmacy, taking more than 4 different medications. Medication interactions, balance, vision, and cognition-altering medications. 3. Behavioral and social, engagement in risky behaviors, social activities that the patient attends, patient's inactivity. 4. Environmental, home organization, tripping hazards, loose rugs, quality lighting inside and outside the home, audio clutter.